Everybody. Today we are looking at, we're going to evaluate the different psychotherapies and look at some prevention strategies, things that you can do or people can do before a disorder or a condition develops. So lots of little questions I want to be able to answer today, but the lesson's not too long, so don't worry. So does psychotherapy work and who decides if it works? Are some psychotherapies more effective than others for specific disorders? How do alternative therapies fare under scientific scrutiny? What three elements are shared by all forms of psychotherapy? How do culture, gender, and values influence the therapist client relationship, which is super important? What should a person look for when selecting a therapist? And what is the rationale for preventative health, mental health programs? Okay, so you can look at the topics here, look at the questions. It does help to pause and just try to answer these before you get started so that when I do answer them in the presentation, it'll kind of stick better. All right, so here we go. So is psychotherapy effective? Does it work? And who decides? So if we're talking about clients, right, people who go in to get psychotherapy, one report reads, or 2,900 consumer reports, readers, let's see. Okay, so based on 2,900 people's experiences with mental health professionals, 89% said they were at least fairly well satisfied. So most people felt like they were like, yeah, okay, I got something out of it. Among those who recalled feeling fair or very poor when beginning, 90% of them were feeling very good, good, or at least so-so at the end. Now, this is not really persuasive for a few reasons. First of all, people often enter therapy in crisis. So they're already at like one of the lowest points in their life, right? That's why they're seeking out therapy. So, yeah, I mean, even if you did nothing, right, chances are you're going to have a better outlook in a few days or a few weeks, even if you don't enter therapy. Also, it's like kind of like you know, if you enter therapy, you need to believe that it was worth the effort, right? You can't. Most people like to think, oh, if I'm paying for this, if I'm spending all my time doing this, it's got to be worth something. So they usually tend to rank a little higher because of that. It's kind of like if you bought something really expensive, and it's actually kind of crappy, you're going to think it's better than it is because you spent money on it, right? You're like, well, I paid so much money, it has to be good. I have to enjoy it, right? Even if it's not that great. So that might also affect people's experience with therapy. And generally, you develop a relationship with your therapist. So, I wouldn't call them not your friend, but you feel amicable toward them, right? You like them as a person. You speak kindly. So you're not going to rate them low. You're not going to rate your experience lower than you started, right? Yeah, for that reason there. In another study, 500 boys aged 5 to 13, half of them were randomly assigned to a 5-year treatment program, so therapy, and the other half was the control group. So they just had normal, they didn't go to therapy or anything. In the experimental group, 2/3 of them, 66%, had no juvenile record. Okay, seems good, right? Well, 70% of the control group had no juvenile record. So in this experiment, it doesn't seem like that 5-year treatment program did anything. If anything at all, it lowered or increased their chance of committing a juvenile crime, right? So that kind of goes against what the last slide was saying in terms of effectiveness. So we really have to let's look at clinicians' perceptions, right? These are this is also not the best way to do it either, right? But if we look at it, so we just looked at it from the client's point of view. Let's look at it from the clinician's point of view. These are also vulnerable to inflation, right? Making it seem like they're more effective than they are because of these two phenomena. Well, the placebo effect, right? If you're going to therapy and it's supposed to be helping you, you are going to believe, if you believe that it's going to help you, just believing that will actually help you. The same way, right? The classic example, here's a sugar pill, right? Placebo. Here's a sugar pill that, cures whatever thing is going wrong with you. You take it, and because you think it's going to work, it actually makes it work. That's the placebo effect, and it applies to therapy as well. Also, this idea of regression towards the mean. So if you come in to therapy at a really low point and you're having a crisis, even if you didn't go to therapy, that would subside, right? You'd head back towards your normal state. Um, so that's going to happen no matter what. Uh, so it's hard to tell, okay, if that's going to happen anyway, then what's the effect of psychotherapy there, right? So that's going to interfere with that, getting a feel for that. So the best way to study if psychotherapy is effective, the real way to study it, is through randomized clinical trials. Okay, and then you take a bunch of those trials and you do what's called a meta-analysis. It's a statistical procedure that combines the conclusions of all kinds of different studies based on, is the psychotherapy effective, right? So one researcher does their study, another does their study, a third does their study, on and on and on. And then when you do the meta-analysis, you take all those studies, combine their data, and then come up with, a result. So the first meta-analysis of psychotherapy showed that clients end up 80% better, or ends up better off than 80% of untreated individuals. So that's represented here. The blue is the untreated person, the orange is the treated. They had psychotherapy. And you'll notice, right, the average psychotherapy client ends up better off than all of these people, right? So 80% of the untreated, right? So this shift here, the shift of the bell curve shows us that, yeah, psychotherapy does have an effect, and it is a positive effect towards a good outcome. Right? Those undergoing therapy, they often improve, but those not undergoing therapy will improve, right? They'll get better from the lowest point, because there's only one way to go, right? But if you undergo therapy, you're more likely to improve quickly and with less risk of relapse. But what people really want to know is how effective a specific treatment is for their specific problem, right? Just saying, yes, psychotherapy is effective. Well, that doesn't tell me how my cognitive behavioral therapy is going to help me with my OCD, right? So we need to get a little more specific. So let's talk about the relative effectiveness of different psychotherapies. There's really no one type that's superior to all others, right? Therapy is most effective when there's a very clear-cut problem. If the problem isn't well defined, then it's hard to pick the best psychotherapy to treat it. Some therapies, like behavior conditioning for treating phobias and compulsions, are more effective for specific disorders. Right, we talked about like aversion therapy or exposure therapy. If you're very afraid of elevators, right, you relax a person and then you slowly put them in more and more enclosed spaces. And over time, right, that technique, that behavioral conditioning is it's good for specific disorders, not so good for other things that are more general, like general anxiety. Pretty hard to treat with behavior conditioning because there's no one cause, right? It's not specific. So psychodynamic therapy has helped to treat depression and anxiety, right? That's one of the insight therapies. Cognitive and cognitive behavioral therapies are effective in coping with anxiety, OCD, PTSD, and depression. Cognitive behavioral, right in the name, right? That's kind of examining the way you think, but also examining your behaviors and adapting your behaviors to be more healthy. So evidence-based practice is the best route here, right? So when you have evidence-based practice, this is a clinical decision that integrates the best research with clinical expertise and patient characteristics and preferences. So it matters what the patient wants. It matters what the clinician thinks because they're an expert, and it also matters what the research says. So you take those three things, and that's what tells you what type of psychotherapy you should probably use. That's depicted here in this, I guess this is supposed to be a table or something, right? I don't know what the thing is. Anyways, there are these three pillars supporting clinical decision making, right? I guess this is the table. So we have the patient's values, characteristics, preferences, circumstances. Those all matter equally as these other two. Then we have the clinical expertise, right? The expertise of the therapist that's helping you. And then the best available research based on the evidence. You take all three of these into consideration when you're making a clinical decision. Okay? So how do alternative therapies fare under scientific scrutiny? So just to get an idea, one national survey, 57% with a history of anxiety and 54% of depression had tried some kind of alternative treatment like herbal medicine, massage, spiritual healing. So most people with these disorders, right, anxiety or depression, right, were over 50% for both of them. So most people try some kind of alternative treatment. I assume because they just don't want to be anxious or depressed anymore, and they're sick of it, so they'll try anything that might help them. So here's one, an alternative therapy that's been disproven, well, sort of disproven. EMDR, eye movement desensitization and reprocessing. Sounds fancy, right? So basically, what this guy would do, Shapiro, would basically have people relive the traumatic scenes while waving a finger in front of their eyes, which triggered their eyes to follow her finger, which made increased eye movement, right? So 84% to 100% of single trauma victims, it actually worked, reported Shapiro. Now, it's probably not the eye movements themselves, right? That's not the therapeutic thing that's happening here. But there is, results show it helped people. So what is it? Well, they did other trials where people would just stare straight ahead while the therapist wags their finger, and the same results ensued. So it's in this case the success is probably just from bringing back up the trauma in an environment that is safe, right? This is a common thing we do with PTSD patients. That trauma causes so much stress and anxiety that if you relive the trauma, as in you bring it back in memories, and you're in an environment that's relaxed, you slowly replace the anxiety with the relaxation, which you can't have at the same time. Okay, so that's probably what was happening here. And the eye movement desensitization and reprocessing therapy. So nothing to do with eye movements. It's probably more about reliving the experience in a relaxed environment. Light exposure therapy. You've probably heard of this one. So seasonal affective disorder, right? I think it's called. People get depressed in the winter because there's not enough sunlight, among other things. Can't do as much stuff outside, maybe. So National Institute of Mental Health, that's what this stands for, suggested giving people a daily dose of intense light because they're not getting enough. After 4 weeks, 61% if you were exposed to light in the morning, 50% if you were exposed in the evening, and 32% of placebo greatly improved. Okay, so placebo is only 32%, light in the morning 61%. That's significant, right? It's almost double the people of significantly or greatly improving. So yeah, maybe there is something to this light exposure. So it looks like morning bright light does indeed dim depression symptoms for many of those suffering in a seasonal pattern, right? So if you have a major depressive disorder, this probably won't help you. Okay, but if it has to do with the changing of the seasons and the less light, then yeah, this does seem to help. And it's just as effective as taking antidepressant drugs or undergoing cognitive behavioral therapy, right? Except way cheaper, and you're not taking any drugs. So light exposure therapy is used, right? It's a very cheap method, inexpensive. You do it at your home, just in the morning, but only for the seasonal depression, right? It's probably not going to help with. I'm not 100% sure on this, but it's wouldn't help as much. I'm assuming you can look this up, or I can look it up. With major depressive disorder or depression that has nothing to do with the changing of the season. We do see that light sparks activity in a brain region that is involved in arousal and hormones. So there is a chemical or a biological thing that's happening by increased light exposure, which is probably the method by which it greatly improves people's seasonal depression. Okay, so what are some commonalities among all forms of psychotherapy? So basically there are three benefits that all successful psychotherapies have. They give hope for demoralized people. People seeking therapy for the first time or for the first time in a while are usually doing it because they're in a very bad place. They're usually demoralized. They just they can't take it anymore, whatever it is. Maybe it's anxiety, maybe it's depression, maybe it's PTSD, whatever it is, they can't take it anymore, so they're demoralized. And this provides hope for people. It also provides a new perspective. You get to talk to somebody about your innermost kind of anxieties or whatever your problem is, and get a new perspective from someone who studies this stuff. So you feel like their opinion is valuable, which it probably is, right? You're assuming it is if they have a degree and they've been studying this and they care for people. It allows that new perspective to come in, which can, right? If we're thinking about perspective, you can think that's cognition, that's the way we think. And also, you and your therapist, a good, successful psychotherapy, develop an empathetic, trusting, caring relationship. So all three of these things we see throughout all the psychotherapies, and they're all benefits. Okay. Right. No matter the therapy or no matter the technique used, effective therapists are empathetic, and they try to understand somebody else's experience. And if you've ever had somebody that really was empathetic towards you and really tried to understand something you were going through, you know that it's very valuable, right? And it really helps. So the emotional bond between the therapist and the client, we call that the therapeutic alliance, right? Which is a key aspect of effective therapy. So to develop that therapeutic alliance, right, we need to think about a few things. So culture, gender, and values. How do they influence that relationship? Therapists differ in values and influence their goals in therapy, and they differ in their views of progress. So these differences can create problems if the therapist and the clients differ in cultural, gender, or religious perspectives. These differences can help explain why minority populations, right, they're reluctant to seek mental health services, or they terminate them prematurely, they end them prematurely, because they don't share the culture, gender, religion, whatever it is, with their therapist, right? Because they're a minority population in whatever culture they're a part of. So let me just say, right? If you find yourself, trying to look for a therapist, don't feel guilty about finding somebody that is the same gender as you, has the same religion as you, shares your culture. That's going to benefit you, right? There's just less things to explain. They'll understand you at a deeper level, right? There's no shame in picking a therapist based on these cultural, gender, or religious values. And I think research does show that it's easier to develop that therapeutic alliance with a therapist who shares those values. Okay. So when should we seek a mental health professional? Well, the APA, American Psychological Association, offers these common trouble signals. So if you're experiencing any of these, right, it's never a bad idea to consult a therapist. It's not going to hurt you in any way, right? And at this point in time, I think it's been pretty destigmatized. It used to be like people would think of it as a sign of weakness. I'm sure some people still do, but that's becoming less and less true. And it's never been true, but it's becoming less and less of a common idea that it somehow shows some kind of weakness to seek out therapy, right? Never been true, but people also now they value therapy more than they did in the past, and hopefully that trend continues. So if you have feelings of hopelessness, deep and lasting depression, self-destructive behavior or substance abuse disorder, disruptive fears, sudden mood shifts, thoughts of suicide, compulsive rituals like hand washing, hearing voices or seeing things that others don't experience, any one of those is a sign that you should probably seek some kind of therapy. Yeah? Everything listed there is pretty serious. All those things are very serious. Okay, so definitely seek some kind of a mental health professional if you have any of those signals. This here kind of breaks down the different helping professions, right? We have clinical psychologists, psychiatrists, right, who are also doctors. They can prescribe medications, whereas clinical psychologists, I believe they cannot. Maybe some can. Social workers, okay, they have less schooling. They can still help, obviously, right? They can't prescribe medicine. And we have counselors, right? They're more general. You've probably seen multiple, we have a school counselor. We have multiple school counselors, right? So you can look at that depending on which help you need. right? I believe only psychiatrists can prescribe medication, and usually have their own private practice. Okay, so that just breaks down the different types of um, helping professions. Okay, what's the rationale for preventative mental health programs? Well, we can prevent psychological disorders in a few ways, and these probably won't surprise you. So, first of all, like resilience, right? This is the personal strength that helps most people cope with stress and recover from adversity, right? Most people don't develop disorders from trauma. That's a good thing, right? That's called resilience. Um, and some, right, we talked about this in PTSD, some even show post-traumatic growth, right? Some develop more resilience from these traumatic events. Um, think about that. Faced with unforeseen trauma, most adults exhibit resilience. Now, we can interpret psychological disorders as an understandable response to a very disturbing and stressful society. According to this view, it's not the person who needs treatment. It's not just the person who needs treatment, but it's also the social context in which they live in that's causing the stress that leads to the disorder. Okay? So preventing psychological problems means empowering those who feel helpless, changing environments that breed loneliness, renewing family, promoting communication training for couples or family as well, helping parents and teachers deal with these problems or creating the environments to prevent these problems. Basically, this is a good quote. This pretty much sums it up. Everything aimed at improving the human condition, at making life more fulfilling and meaningful, can be considered primary prevention of mental or emotional disturbance. After-school programs, tutoring, joining clubs, hanging out with friends, doing things that are fulfilling and meaningful, finding hobbies. Maybe we don't think about this as preventing psychological disorders, but essentially doing things that are fulfilling and meaningful are doing just that. They're preventing disorders from occurring because they increase, our mental and emotional well-being. That includes cognitive training that promotes positive thinking for children at risk for depression, right? Which is just, cognitive training is just changing the way we think, right? Oh, I failed a test. That doesn't mean that I'm dumb. That doesn't mean that I'm not going to be able to get a job. It doesn't even mean that much, right? So just changing the way you think about a failure or about some kind of mishap is important, right? Because that can prevent a later disorder from developing. Okay, so a whole bunch of check for understanding questions here. You go ahead and pause this slide, read through these. Hopefully you can answer these. And then we got some FRQs you can also try as well, right? It always helps to do these, just solidify your learning. Otherwise, I will see you at our meeting. If you have any questions, if it's outside of office hours, feel free to send me an email. Okay.